As a neurosurgeon, I perform microdiscectomies as a very common procedure in my practice, as do most neurosurgeons. And by and large, patients do very well with this procedure, which has been with us now for decades. It's an operation that in most surgeons' estimations is not only common but very, very efficacious, with a relatively low complication rate and a high success rate. The reality, though, is that if you critically analyze your personal experience with microdiscectomy, you'll find that there probably is a significantly higher complication rate than one would expect. And in particular, that complication rate is primarily related to recurrent disc herniations. Many recurrent disc herniations are asymptomatic. Some of them are not, and for a significant subset of patients who do suffer recurrent disc herniations, many will require further surgery to reoperate and remove the recurrent herniation. Some of those patients will also require a more involved procedure than a redo microdiscectomy, specifically a fusion type procedure. So in looking at this very common operation with what probably is a higher complication rate than we are aware of or have been previously aware of, it has been an area that has been looked at to try and see if we can develop strategies to decrease this complication rate, to decrease the rate of recurrent herniations. And over the years, many different strategies have been employed. And more recently, we have strategies including annular repair techniques, which have shown promise in decreasing recurrent herniations. And I have, since these types of procedures have been brought to bear, have come into play, I have included them as part of the routine care of my patients with herniated discs. In most cases, I would say, when I have a patient with a herniated disc who fails conservative management and ultimately comes to surgery, I will plan to do an annular repair procedure in conjunction with a microdiscectomy. In my mind, adds very little in terms of time, in terms of risk to the patient. And in my own clinical experience, I have found that my patients do much better in terms of their recovery. They're able to get back to their usual activities quicker because I'm more confident in allowing them to do so, and also seeing a significantly decreased recurrent disc herniation rate in this patient population. And so for this reason, I include this as a routine part of my discectomy procedure. So for most, if not all, of my microdiscectomy procedures, I'm now incorporating annular repair technology and techniques as part of the surgical procedure. There are relatively few cases in which I do not employ annular repair techniques, and those would be cases where someone has suffered a recurrent herniation and I go back in to remove a recurrent herniation. In those cases, sometimes there is not enough of an exposure or an excess of scar which precludes safe placement of the device that I use to repair the annulus, which currently in my practice is the X-close device.